Have you heard this one, that if you eat a lot of fruit, it's because it's so high in fructose, it's going to make you fat. Even worse, it's going to destroy your liver from non-alcoholic fatty liver disease. If you've heard that, I really want to talk to you about what the truth is regarding fruit. So this comes from this confusion of taking an ingredient, so fructose, and isolating it, like in high fructose corn syrup, and then attributing something negative to fructose wherever you find it. So it is very, very different to have a cup of blueberries versus to have a soda high in high fructose corn syrup. I mean, you can't even make any sort of correlation between the two, other than the blueberries are very good and the soda is very bad. So this confusion just really has come from, oh, fruits have a lot of fructose, that means they must be bad. And they're not. So they're high in phytonutrients, they're high in fiber. And I have some good studies to back me up. But first, before we go into that, let's talk about, sorry for let's see, I don't have the prettiest background here. It's a little bit better. Okay, so what are some of the best fruits? I've mentioned one, blueberries, but the berry family, so blueberries, raspberries, strawberries, blackberries are all great. Avocados, which we sometimes don't think of as a fruit because it's not sweet, but it is absolutely a fruit. It's very high in monounsaturated fats, which are great for us, which I'm going to talk about in a moment. But then there's watermelon and lemon and dates, which are very high in fiber, so they're very filling, very sweet, but not bad for you. Cherries, pineapples. So what's in common about these foods? Of course, they've got, yes, they have fructose, but they also have fiber. They're high in vitamin C, they're anti-inflammatory. There's something found in cherries that can reduce your toxic level. And then, of course, bananas, I didn't mention, are high in potassium, and overall high in fiber, as I mentioned, and can decrease inflammation. So fruits should absolutely be an integral part of your diet. Okay, saying hi to Las Vegas, hi Vegas. And so I don't want you to be afraid of them. Now, definitely familiarize yourself with what's called the Dirty Dozen list versus the Clean 15 list. So you'll find where avocados do not have to be organic, so they're not on that Dirty Dozen list. Strawberries absolutely do. Apples absolutely do. So it is important, as you're enjoying your fruit, to find out which ones really have to be organic, because you don't want the negative of all the chemicals affecting your health, versus the ones you can get away with, like blueberries. So strawberries have to be organic, blueberries are fine, blackberries are fine. So anyway, you'll just get familiarized with this list and use it. That's very important. But the reason I wanted to talk about this today is, we all have our pet peeves in our business. I'm sure you do as well, where somebody says something and you're like, oh, everybody, how did that get popularized, when it's completely false? And so this concern about fruit is one, as a clinician, that I hear a lot. It's like, well, I've really cut down my fruit. I love my fruit, but I know I shouldn't eat it. But I do have a piece a day, and patients are almost apologizing for their one piece of fruit a day, when it would be beautiful to have 3 pieces of fruit or 3 servings of fruit, of healthy fruit a day. So there's a couple of studies I want to review. One was in the journal Nutrition in 2019. And the title kind of gives it away, but no association between fruits and vegetables and non-alcoholic fatty liver disease in men and women who are middle-aged. And these researchers were all from Japan. They were concerned, this concept of non-alcoholic fatty liver disease was going to be exacerbated, made worse by eating fruit, and so they wanted to do this study. And they found, as the title gave it away, no association. And so their summary was, okay, Japanese men and women, enjoy your fruit. It's not sabotaging your liver. But we do know that when it comes to non-alcoholic fatty liver disease, highly processed carbohydrates and just a poor diet, generally speaking. So non-alcoholic fatty liver disease, I know it's such a mouthful, but they gave it that word, that term. They created the term non-alcoholic fatty liver disease, because historically, before our diets got so bad, fatty liver disease was really associated with alcoholics. And so if somebody's liver was fatty, they had cirrhosis of the liver, they were an alcoholic. And so one was sort of correlated with the other. And then as we got less and less healthy, people were having dangerous liver disease and infiltration of fat, and they were not alcoholics, or maybe they didn't drink at all. It had nothing to do with alcohol. So then we started to find out that our highly processed diet and bad fats, etc., was contributing to this. But you tend to see non-alcoholic fatty liver disease go hand in hand with obesity, hand in hand with diabetes type 2, hand in hand with heart disease. So these diseases are kind of marching down the road together. So we do want to make sure that we're not doing anything inadvertently to worsen that condition. So the other study was just in Nature last year, 2022, and it was called Dietary Carbohydrates and Fats in Non-Alcoholic Fatty Liver Disease. So they were looking at saturated fats and refined carbohydrates, and that they found appreciably what was worse for leading to non-alcoholic fatty liver was high saturated fat. So their summary was that the Mediterranean diet, which is low in saturated fat but high in the monounsaturated and polyunsaturated fats, and we've gone over this on the channel, but you can look this up. So high in those fats, very low in refined sugar, high in fruits and vegetables and beans and legumes, that this was the diet that was most protective to the liver. And yes, and high in dietary fiber. I left that out as well. So the Mediterranean diet is naturally high in dietary fiber, as are fruits, and good for you vegetables. So hopefully this makes you feel better about eating fresh fruit. Now, I'm not talking about drinking the juice. I'm so glad I remembered that. So that is another pet peeve of mine. Don't take that perfectly good orange and juice it. Eat the whole orange, and you can peel it first. But eat the whole orange, because it's a very different beast when you're eating the whole fruit with the fiber versus making juice out of it. That is too high from a refined sense. So anyway, I hope this was helpful for you. If you like the channel, please subscribe, give the video a thumbs up so more people can see it, and enjoy that fruit, and I'll see you tomorrow.